Hi everyone, and welcome to the 25th episode of Vitals and Voices. I'm Lathika and I'm the founder and host. Vitals and Voices combines multiple experienced voices and opinions in healthcare in order to spread a positive message about medicine. Now please welcome our guest, Chloe.
Hi everyone.
Chloe, thank you so much for being a part of this episode. It means so much to us that you'll be one of our guests on Vitals and Voices. Feel free to kind of introduce yourself and share some things about yourself as well.
Perfect. So I am a second year Master's of Public Health candidate at Vanderbilt. And so I'm actually on the global health track, and that's kind of stemmed from my work that I did during undergrad. And so I'll talk about that a little bit more later, I'm sure. But I recently graduated from the University of California, Davis with a Bachelor's of Science in Neurobiology, Physiology, and Behavior with a minor in Psychology. And I absolutely loved my time there. I was able to get involved with a sorority and I met some of my closest friends who I'm still really close with today. And yeah, it's been a journey going straight from undergrad into my master's. Um, I really don't think I would have done it any differently. I feel like I've really grown in my career passions and just my different experiences. And I hope to apply to medical school in May. I just recently took the MCAT. And so I'm really excited for that process and how it will go. Obviously, very anxious, but I think I'm excited to kind of combine my public health background with also a career as a physician. And the ultimate goal would be to help um, make outcomes for specific individuals a little bit better through like public health education. Um, and I'm a huge believer in health equity, and so I think it'll be the perfect route for me to be able to accomplish, I guess, my internal mission.
I really love that, and congratulations again, Chloe, for taking the MCAT. So, can you tell us a little bit more about what kind of inspired you to go into healthcare and kind of take that big step and apply to medical school later on in life?
Yeah, I would say, growing up, I am the child of an immigrant, and also my dad is only second generation. So I think that background mixed with different professional experiences kind of came together and have made me really passionate about working with underserved communities. I would say like where my passion for like helping others really started with was Girl Scouts. I grew up doing Girl Scouts my entire childhood. And it was really fun because I learned like volunteering, the power of volunteering, how good it feels when you are able to go and like dedicate your time to helping someone else. And so we worked in like animal shelters and we worked with like serving meals to the homeless. And I just feel like that kind of ignited this passion for working with underserved communities. And so also I'm from Los Angeles, specifically Pasadena, and we do have a pretty big unhoused population. And so I really enjoyed every single year. We would go and work. It's called I actually can't remember the name right now. But we would go every single year and we would volunteer and either you're like making the food because we would like make food, bring it. It was like a Thanksgiving. Oh, it's called Gobble Gobble Give. And it's through like LA Works, and it's such a great organization. And so you go, you bring food you'd made, everyone brings food that they've made, and then we all package it into like a little container and we drive throughout Skid Row to hand deliver these meals to people. And so that was really impactful for me because like I would always go with my entire family, and my dad always made it his mission to like try to find the people farthest away from like the downtown center. Because at the downtown center in LA on Thanksgiving, they have tons of organizations that come and like give away like free meals. And so we really wanted to find the people who didn't have a means to like be able to even walk there because of maybe a disability or because they're too far. Maybe they didn't even know about it. Um, and so that really stuck with me. And so in undergrad, I worked with Sacramento Street Medicine, which is this incredible organization in Northern California that like a couple days a month, they on the weekends, they go out with like physicians and like students, medical students and or just undergraduate students. And we would go to different and house people camps and try to see if they had any like pressing medical issues that we could help with. And so I feel like just like throughout my career, I've been able to kind of combine all these interests of working with underserved communities, healthcare, medicine, and kind of put it all together. And that's why I'm pursuing my master's in public health, because I think that is like at the forefront of my personal mission. And so I really wanted to kind of learn more about it in like an academic way before I was going to become a physician and practice it.
I really love that and how, your master's in public health is really shaping you to the person you're becoming today and hopefully the physician that you'll become one day as well. So, could you tell us more about your work as a clinical research assistant in the labor and delivery unit?
Yeah, of course. So by going to Vanderbilt, I've had so many incredible opportunities, and this was definitely one of them. I currently work in the labor and delivery unit as a clinical research assistant, and I'm specifically on the biospecimen collection team. And so what this means is I work mainly nights. I have access to like patient information, and I know when mothers who have previously been consented to our study are in labor or about to deliver. And once they deliver, I go to the hospital, which is like fairly close to me, which is really nice. And I collect their placenta and cord blood, and then I process it. And so we have about five different studies that are all focused on different factors in terms of like substance use or just different exposures that maybe the mother has had. And we're trying to look at different, I guess, things that have come out of that. And so it's been really exciting. I love like anatomy, and I've had the privilege of being able to be in a cadaveric anatomy lab. And so it just kind of reminds me of that environment. And it's actually in the my like office lab is actually in the hospital, literally on the labor and delivery unit floor, like in the postpartum section. And so it's really nice. And sometimes I do get to interact with the patients as well. If I have to do a follow-up survey, I'll have to go and like try to coordinate with the patient for them to fill it out. And so it's been a really great experience of working in a wet research lab, but also getting to interact with patients, especially mothers who are in a very like vulnerable time. And so I have to be incredibly empathetic and incredibly thoughtful about when I go. So if I work nights, I probably don't get to interact with patients, but I do work on weekends sometimes, and that's like a nice time to go. And like it's so exciting seeing their whole family there with the new child. And yeah, it's been a great experience.
I really love that again. So I know you spoke a little bit about your father in the beginning, but how do you think growing up as a daughter to immigrant parents has impacted your background and kind of led you to the person that you are today?
Yeah, so I would say to me, being the child of immigrants is very important to me. I think I try not to forget about it, and I understand the sacrifices that were made to get me to this point. I think as I've gotten older, I've really appreciated just how lucky I am to be in this position, to choose the career that I want to go get a master's degree, to like kind of do these things that I don't even think my grandparents thought was imaginable. And so again, as I think I've gotten older, I think I've really understood that and I've begun to ask more questions. And so on my dad's side, my dad only went to high school. His mom went to the third grade, and my great grandmother, her mom, also only went to the third grade. So and thinking about like the magnitude of the opportunity that I get to go to Vanderbilt and get a master's is like mind blowing to our family. Like it's like such a great honor, and I'm completely humbled by it. And I think that it kind of has forced me to be really grateful. Bunch of grit and determination and resilience because I understand that these opportunities are not given, that I have to fight for everything that I've done. And so I think it just has a lot of um I feel like I have a lot of support, and I think that allows me to do what I'm doing. But I think also more than anything, I'm very fierce in the way that I approach these things because understand that they're not warranted or guaranteed. And I think when it comes to healthcare, the main reason I really wanted to go into healthcare was I think from early personal experiences. I have two grandmothers. One came to the United States on her own. One, she was in Mexico and she was in an orphanage and then later came to the United States. But the one that was in the orphanage had people come visit, like doctors from America. They would come visit the orphanage and they would talk about health education. They would talk about the importance of like brushing your teeth and like sanitariness and hygiene. And I think because of that, that grandma realized how important healthcare was and getting your physical. And even if she was not able to afford it, when she eventually moved to California and moved to South Central LA, there were other like free walk-in clinics available in those areas. And so she made it her number one priority to take her and her four kids to these walk-in clinics. And so they all have really good health to this day. My other grandma, unfortunately, she did not really grow up or have that exposure to health education. And so she has type 2 diabetes, which, as we know, is something that comes with health education and can be, um, have better health outcomes with health education. And because she just didn't have access to that, now I get to see the different health outcomes and that she has type 2 diabetes. And so I think that just literally in my own family, I'm seeing the um, consequences and benefits of public health education. And so I think that really drove me towards healthcare.
I love that again. And yeah, I definitely agree with you. My grandparents, on my mom's side, they only like completed high school back in India. It was just high school. And so they got like married at like 18. And then
Hmm.
of course they had my mom and then like my mom's brothers as well. And I think that really shaped my mom's values and beliefs because she was able to get her bachelor's at a very young age in India, and then coming to America, she never thought she would be able to get a master's in education and later on her doctorate, which is so surprising to me. And it just shows how, like, even if you're like from a family who doesn't have a lot of education background, you can still strive and be that person who makes that change. So I really love that story.
Hmm. Thank you.
Of course. So I might say this wrong. Is it comma or coma, the social
Comma.
enterprise? Comma? Okay.
Hmm.
We would love to hear more about comma, the social enterprise that you intern at. Could you tell us more about it?
Yeah, absolutely. So, as a part of my master's program, I had to do a practicum this summer, and I decided to split my time because I kind of want to see both aspects of the companies I worked at. I worked at the Tennessee Department of Health and the Traumatic Brain Injury division, and so I worked on finding resources for those who had a traumatic brain injury, and so that was a fun experience. I got to work in more of a governmental um, position and that kind of opened my eyes to maybe ways to make things more accessible. And so that's kind of what I did my work on there. And then the second half, I worked at Comma. I've always had a very big interest in entrepreneurship, business. I've created businesses like my entire childhood. And so I thought it would be a really cool way to kind of build on that knowledge. And so Common's a social enterprise, and they're a female-founded integrated period care company. They have a flagship product called Sarah. And it basically is the only HIPAA-aligned period tracking app on the market. I think as we've learned from when the first few period apps came out, your data is not safe and secure in these other typical period apps. And I think for me, I realized how important it is, especially in this current administration, how important it is to have safe and secure data. And so when I first heard about it, I was really excited. I love the app. I think it's incredibly easy to use. And it's a progressive web app. So that means that you like download it on the internet and then you can add like a shortcut to your phone. So it'll function completely as an app, but it just isn't connected to the App Store, which will take your data and sell it to whoever is the highest bidder. And so I think that was really cool aspect that comma has. I think there are lots of space for it to grow in the future. But in terms of what I specifically did at comma, I was the PCOS cohort development and clinical research intern. And so throughout my time, I recruited a cohort of women who have a clinically confirmed diagnosis of PCOS, and they were able to come in, use our app, and that kind of helped train our algorithm to understand what are the differences between a woman who does not have PCOS and a woman who does, and just in terms of their menstrual regularity, in terms of their different symptoms. And so halfway through my practicum, we were able to publish a survey within the app. So it's a new tool that's the PCOS condition monitoring tool. And so I have PCOS and I've been able to go in and like every so often answer the survey and kind of see where I rank in terms of severity. And so for an individual who does not have a clinically confirmed diagnosis of PCOS, they also have access to the same survey. They can fill it out and they can see how close your symptoms are to a person who does have PCOS. And all we really want to do is just to have open and honest conversations with our physicians. I think oftentimes women um, are maybe not aware that these things even exist. They're just like, wow, I have horrible cramps, I have acne, I have hairy this or that. And I think that because these topics are so taboo, we aren't having open dialogues about them, but it's so incredibly important. Um, And so, yeah, that's what we were doing with this app. And that's kind of what my thesis work is building on. I'm just trying to validate the survey just to see its sensitivity and severity scores amongst other clinical guidelines. And so that's what I'm kind of working on at the moment. But yeah, it's been a great experience. I highly recommend Sarah. And they have an Instagram and it's called your comma with an underscore. And it's incredible. I think that it's such a good way for women to kind of take charge of their own health, and have autonomy over their own data, and then they can decide what they want to do with it. So, highly recommend.
I love that. And I love how the app doesn't, sell your data. So that's really interesting to hear about. So, how do you think that focusing on smaller parts such as mentorship, conversations, and small community projects free a role in advancing healthcare equity?
Yeah, I think, in order to have a truly diverse healthcare system, I think we need to have everyone involved. I think we need to see every single type of individual within healthcare because those are the people that exist in America and all over the world. And I think people really, I mean, there's been research to show that people feel a lot more comfortable when they see someone that looks like them when they're getting healthcare, when there's not a language barrier per se, or even a cultural barrier. And so I think representation in medicine is critical to advancing um, health outcomes. And so, along that line, I think as humans and as individuals, we need to do what we can to try to uplift those around us. I have enjoyed thoroughly being able to be in the sort of like Medfluencer Instagram community. Because a lot of these people, even with as many followers as they have, they're so open and willing to have an honest conversation with you about how to get from point A to point B. And it's so confusing. And so I feel like just seeing people be open for mentorship or be open for spreading resources, information, I think it really demystifies how to get into healthcare. I've been fortunate to work with an organization here at Vanderbilt where they kind of introduce high school students to different careers in healthcare. Because I know that like a doctor is like one of the more I guess, well-known pathways, but there's so many other ways to get involved in healthcare that isn't becoming a physician. And I think it's important that our youth becomes aware of those opportunities, and has a seat at that table. And so I think that any way that a person can make those seats well known or like open up seats, maybe bring more chairs to the table, I think that's like our, I guess, responsibility to make sure that those things are happening so that everyone feels that they have access or able to get access to healthcare, that everyone feels seen. And so, yeah, I feel like it's a huge responsibility of all those who are hopeful healthcare providers in the future.
Yeah, definitely agree. Representation truly matters in healthcare, and it's really like important to kind of tell teenagers and young adults that there's so many different healthcare pathways and careers other than becoming a physician. Yeah. So, to wrap things up, do you have any advice for anyone that is applying to medical school or even taking the MCAT that are also anxious about kind of advancing their journey through healthcare and medical school?
Yeah, I would say being anxious is completely normal. I think it's really hard to go through such an intense process without feeling some sort of anxiety. I would say that I've leaned heavily on my peers, my friends, my support system, and even again, like any resource that is publicly available, i.e., like Instagram or like speaking specifically to the MCAT, like Jack Weston. I think it's so important to take advantage of those resources. um Reach out to your friends. For example, I have a couple friends that have already taken the MCAT, so those were the first people I talked to. I would just Some of them I formally set up a Zoom, and even though they're my friends, I was like, okay, let's talk over Zoom. Show me your screen. How do I download Anki? Like, how does Anki work? Like, I don't get it. um or like with my other friend, again on Zoom, I was like, what does your study schedule look like? Like, I don't understand how I'm supposed to learn all this in like this amount of time. And so I think, like, don't be afraid to ask questions. Definitely reach out for mentors. I've been very lucky that at Vanderbilt I've been given mentors, and not necessarily have to like find them, but just really making those relationships very close. All three of my mentors are all female physicians who are big role models for me, and I can ask them a lot of questions. But I think even if you aren't in my specific situation, I think many physicians, especially even young and old physicians, are so willing to talk to you. Um, I've been able to shadow OB-GYN, infectious disease, pediatrics. I'm going to shadow oncology pretty soon. And all of those have single-handedly been through cold emails or just creating a network. And I think your network is the most valuable thing that can happen to you. I got my internship from Comma because of my like Vanderbilt MPH alumni network. Um, and I think one, creating a network and not being afraid to go up to people. It's actually one of my favorite things. I am a socially anxious person, but in an environment where I understand the magnitude of how important this person is, I will gladly go up to them. So I did a conference in DC, and I went up to so many like state representatives. Like, I went up to this lady who is the founder and CEO of the Latino Health Advocacy Organization. And I was like, oh my gosh, you're amazing. Like, tell me more. And she was like, oh, we're actually creating a youth advisory board. You'd be perfect. You're on. And I was like, what? And I think it's such an incredible opportunity. I just got like the formal letter of like getting on that. I'm going to start that soon. I think it's crazy to think of how easy it can be just to do it, just to go up to someone. It's very nerve-wracking. But I think if you're truly passionate about healthcare or whatever field you're in, you need to make those, I guess, like scary interactions of going up to people and just seeing what can happen from that. I mean, if they're in a position that you want to be in, they probably know more of how to get there. And so they're the perfect person to talk to. So, yeah.
Definitely. And congratulations on getting the youth advisory board position. And, yeah, networking can be scary sometimes, but it's definitely a huge reward if it really ends up being something that you do want to pursue. Yeah. Well,
Mhm.
Chloe, thank you so much for sharing your story with us and telling us all about your incredible accomplishments. It's so inspiring to hear about your background and the things that you want to accomplish in the future. To everyone tuning in, thank you so much for joining us on this episode of Battles and Voices. Your engagement and support mean the world to us. If you enjoyed this conversation, then be sure to follow, share, and stay tuned for more episodes on Battles and Voices. We'll see you next time.